you're likely insufficient in this vitamin. And if you take PPI medication, it makes it even worse. So what are you at risk for? Osteoporosis or brittle bones, weakening of your immune system, higher risk for respiratory infections as well as just generalized infections. It also puts you at risk for heart disease and type 2 diabetes, cognitive decline, and certain types of cancer. It puts pregnant women at risk for preterm birth or pre-eclampsia. So it really affects all ages, because when you're insufficient in this vitamin as a child, as a young child, it's putting your bones at risk. You can have shorter stature, or even if it's quite deficient, deformed bones like a bow leg. So this really is for everyone, and the new research is all about the sunshine vitamin, as we like to call it, vitamin D. And what was so interesting about this study is that they looked at children, and these were children that were diagnosed with celiac disease. Now, celiac disease is an autoimmune disease, and it's caused by gluten, and it really impacts your absorption of a lot of nutrients, vitamin D among them. So they took these kids and they evaluated them in a country called Uzbekistan, which is in Central Asia, because Uzbekistan has 300 days of sunshine in its environment. So the sun is shining pretty much all the time there. Therefore, it was really testing the concept, does enough sunshine make adequate levels of vitamin D? And in these children with a compromised gut absorption ability, it did not. And it was 80% of them were deficient, not just insufficient, but deficient, and showing short stature, some deformed bones in the highly deficient children. But it spoke to the fact that the sunshine vitamin doesn't just work with sunshine, and we have to be much more mindful of what our levels are. Also the interpretation of those levels. So we agree that deficiency is less than 20, and the nomenclature is nanograms per milliliter. So if you look at your annual physical blood results, you'll see NG/ml. The L is capitalized, and that in the US, that's how we measure it. In other countries, it's a little bit different. But less than 20 is deficient, which is terrible. Insufficient is gauged from 20 to 29. I would argue that point a little bit. And then sufficient is considered 30 to 60. However, other studies showed it as 40 to 80, which I'd be more in alignment with. I like it 50 to 60-ish. So you can just look at your numbers and see, but you really want to be that 40 threshold to consider you're in more of the optimal range. So if you're below 40, I would consider you insufficient. And it's very important because of all the things that it does. We call vitamin D a vitamin. It's actually a hormone, and it has its fingers in a lot of different pies when it comes to your overall health, as I mentioned earlier. So what I wanted to talk about are the people who are at risk. So yes, if you have celiac disease, it's an autoimmune disease, we know your ability to absorb nutrients because your small intestine is so compromised, we know that's at play. And that's what was so interesting about this study, because they said, well, if it's all about sunshine, we got plenty of sunshine here. How do these children do? And they did very poorly. So who else is at risk? If you have irritable bowel disease, you're at risk. If you have small intestinal bacterial overgrowth, it's called SIBO. Up to 22% of our population has that. And here on this channel, we talk a lot about hiatal hernia syndrome and acid reflux, so we're really focusing a lot on gut health. And small intestinal bacterial overgrowth can cause acid reflux, it can cause hiatal hernia, and it can cause you to not be able to absorb vitamin D. And also obesity. 40% of our population is obese, and when you're obese, you're less able to absorb vitamin D. So that was the reason I wanted to discuss this, because so many of us are at risk, and the implications for your overall health are quite severe. Now, I also mentioned if you are a PPI user, because that destabilizes your body in a lot of ways. One is your ability to absorb calcium, so therefore strengthen your bones, also magnesium, also vitamin B12. So it falls into that arena of setting you up for osteoporosis, setting you up for dementia, cognitive decline. So there are some similarities there as far as the risk profile of PPI and what happens if you're insufficient in vitamin D. So what is my recommendation? Get your vitamin D tested, and get it tested in your children. And if you're a mom who's pregnant, you want to raise those levels and get them to the optimal level. And if you're thinking about becoming pregnant, everybody should have optimal vitamin D levels. And it affects us in different ways at different ages, but it absolutely will affect you. So get your vitamin D tested. When you take vitamin D3, not D2, vitamin D3, pair it with a K2. I just like a liquid where they're paired together, so it's very simple. And then depending on how deficient you are, then your level would be higher. Also, if you have a SIBO or you have an irritable bowel disease or a celiac disease, you're going to need higher levels to achieve the blood level that you require until you get your gut healed. So because the gut is inflamed and it's not absorbing nutrients as well as it should, then you're going to lose a lot. So you're going to have to play with what level you need to ingest in a supplement, even if it's the best supplement in the world. If you're losing a lot of it due to malabsorption, your blood levels are still not going up. So you need somebody to work with you on that and assess what levels you need. And then, of course, what I'm hoping you do is get to the root cause of why you have the irritable bowel disease and the SIBO. Those are things that are very treatable naturally, as well as acid reflux and hiatal hernia syndrome. So, but while you're getting to the root cause and enhancing your absorption, you'll likely need more higher levels of vitamin D to compensate for that. So have somebody work with you on that, and we're more than happy to if you don't have somebody, but trying to find a clinician who really understands this is key. And someone who will look at a level of vitamin D at 30 and say you're fine, they're not an expert in this area, and you need somebody who understands it and knows what optimal is. So that's the data on vitamin D. Please take this to heart. Have your family checked, and I think you'd be surprised at some of the levels. And I'm taping this, it's almost fall, and we're moving into those months where it's cold and dark, and we're not getting a lot of sun. So we definitely, but we do have a lot of infections, right? That's when flu season happens. So this is a brilliant time to get your vitamin D optimized. So I hope you enjoyed this information. To hear more, definitely like and subscribe. I love your comments. I answer all of them. We're trying to increase our subscribers so more people have availability to the channel and get this type of information. So if you liked it, do that, and I'll talk to you soon.